Hi, Dr. Jen. I'm a double board certified fertility doctor. And today I was going to do fertility doctor versus ChatGPT. I use ChatGPT a lot to look up medical questions I have in other specialties, like say for my family that aren't related to my specialty. And I'm always curious what an expert would think, how well does it work? So I thought I would ask ChatGPT a fertility question and see if I agree with it or give my take on it and compare to what ChatGPT says. So I check out part one if you haven't seen it. That went over the initial start of the initial workup. So I'm going to complete the initial workup in this video, and also we'll look at what ChatGPT recommended for the treatment and see what I think and see if it's accurate. So the question I asked ChatGPT was, what fertility treatment does a 40-year-old need who has been trying to conceive for 6 months? So that's what I asked it. So, and in the first video I went over, it said the woman should move directly to an evaluation, which I agreed with. I will also say and treatment. That's what I believe. I'm adding that part. And they recommended ovarian reserve testing. ChatGPT recommended ovarian reserve testing, AMH, day 3 FSH and E2, antral follicle count by ultrasound. So I went over that in part one if you're curious. They also recommended to check ovulation and hormones. So ChatGPT said check TSH, prolactin, and progesterone to confirm ovulation, which is optional. So I do agree. Usually as a fertility doctor, we are checking TSH because if you have low thyroid or hypothyroidism, so thyroid's a hormone that's actually made from the thyroid gland in your neck, but if you have low thyroid hormone, it can throw off your menstrual cycle or make fertility treatment not as successful. So you do want to check TSH, and if there's an imbalance with your TSH, you would correct that before fertility treatment and before pregnancy. Another hormone that's checked is prolactin. So I do agree, we always check those when a patient first comes in. That's part of the routine fertility workup. Prolactin is a hormone that's made in your brain. If you have high prolactin, that can also throw off your fertility and your ovulation. So I agree with checking those. And then the progesterone to confirm ovulation, we usually do a baseline check of estrogen, FSH, LH, progesterone when the patient comes in, so we can confirm where they are in their cycle. It's not always to confirm ovulation. If a patient has regular cycles, so every 28, sometimes when you're in your 40s, your cycle gets shorter. So instead of being 28 or 30 days, it can be 24 to 26 days. Why that is because as you get older, your FSH increases because it's basically kind of like the ovary gets less responsive. You have less eggs in your ovary when you're in your 40s, and your brain is making FSH and sort of going to your ovary and telling it to grow eggs, and it produces a lot more FSH in your 40s. So it's kind of like almost yelling at your ovaries to make the eggs, and your FSH goes up. So because your FSH goes up when you're in your 40s, the eggs can grow more quickly. So they may even start growing before your period. And so your ovulation will be pushed earlier in your cycle, and your overall cycle will be shorter. So it will push it shorter by a few days. You can get a 24, 26 day cycle. If I see someone that has a 24-day cycle on a regular basis, I'm already thinking their egg reserve is a little low, their FSH is high. I'm already thinking about this as I just hear about their cycle length, because I know with a 24-day cycle, someone who's regular cycling at 21 or 24 days, oftentimes, again, I have to make sure prolactin and TSH are okay, but oftentimes that's because they have low egg reserve. So that's a sign to me on the cycle length that there is low egg reserve in a 40-year-old. So that's one thing I check, I would say. So I would say ChatGPT didn't really talk about taking the history. So that was kind of interesting. So that's something as a physician we would definitely do. We would want to talk to our patients and find out their history, like their menstrual cycle. I always call the menstrual cycle interval as like one of our vital signs, because there's so much information we can get from knowing the menstrual cycle interval and knowing about the periods, whether they're very heavy, which can indicate like fibroids, super painful, that can indicate endometriosis. Both those things can affect fertility. So I'm going to pick a bone with ChatGPT that they didn't mention anything about taking that history piece, which is really important. And you would miss a lot if you didn't take that history. So, but anyway, with those hormones, TSH, prolactin, and progesterone, I do agree with that. And then they say to check the tubes and uterus. So yes, those are really important for pregnancy and fertility. So I do agree with checking the tubes and uterus. It said to check an HSG. So that's to make sure the fallopian tubes are open. So here I'm going to also say I differ from what I would recommend from ChatGPT, because I think that when you're 40 years old, and a lot of times the treatment is to go directly to IVF because of what we talked about in part 1, which is problems with egg quality and quantity. And so IVF is the best treatment. And if you're doing IVF, you don't need to know at that time if your fallopian tubes are open, because nothing, usually that's where the egg and the sperm meet, is in the fallopian tubes. And it's really critical, say if you're doing IUI, to know if your fallopian tubes are open. But the HSG can be a painful test. A lot of women don't really like doing it, which I understand, it's painful. And if you're doing IVF, it wouldn't be my first step that you need to know if your tubes are open. You want to know if your tubes are full of fluid, because later on that's important if you're putting an embryo into your uterus. But in the beginning, if the first line treatment may be IVF, the most important thing is not to check if the tubes are open, because IVF doesn't use the fallopian tubes. IVF takes the eggs directly from the ovary. They get fertilized with sperm outside the body in the lab, and then the fertilized egg or embryo gets put back through the cervix into the uterus. So whether or not the tubes are open is not a key part of what you need to know, basically, at this point. So I would say it's not wrong, but it wouldn't be the first thing I would do. So I would vary. My workup would be a little different than ChatGPT on that. I do recommend checking the uterus. Fibroids are really common, especially as you get over age 40, and especially in African American women, but also in other ethnicities, races as well. So an ultrasound can check for that. It checks like the shape and size. It checks for fibroids. So it can tell us a lot of important information about fertility. So I do recommend an ultrasound, and most fertility doctors will do an ultrasound when you first go to check for these things. So you also can check for the egg count, which I talked about in part 1, the antral follicle count. And while you're doing that, you can check on the uterus too and get really important information about the uterus. So I would say instead of an HSG, I may do an ultrasound to check the uterus. So I would be different than ChatGPT there. And then it recommends partner testing because male factor is present in 48% of the cases. And I agree, that's a big important thing that sometimes is overlooked, because it's often the woman coming in for the fertility check and the fertility workup. But again, almost half the time, it's so important. We find problems with the semen analysis. So it's a super important thing that can't be overlooked. So I definitely agree on that one. Okay. Now let's see. ChatGPT says what treatment is recommended or is needed. It depends on the test results. So ChatGPT is saying if tests are normal, like tubes are open and sperm is good, regular ovulation, first line is IUI. And if ovarian reserve is low or age 40 with multiple months of trying, move to IVF. IVF is the most effective option. So I would say I do disagree with ChatGPT here, because I think over age 40, this patient has been trying for 6 months and her egg quality and quantity is declining very rapidly at this point. Once you lose that quantity and quality of eggs, you cannot get it back. So I would not, basically what we say, waste time doing a treatment that's not as successful. So IUI success rates are much lower than IVF, and they can take multiple cycles to see a result. So if you're doing a less successful treatment that takes a lot of time, it can actually like do harm. So it can not, you can lose that chance of those using those good eggs. Once you're over age 40 and you've been trying for 6 months, you want to move directly to IVF because it works much better. The success rates per cycle are much higher, and you don't have a lot of time. So that's what I would differ with ChatGPT there, where it did say if ovarian reserve is low or over age 40 with multiple months, move to IVF, which is basically how I see this scenario with trying for 6 months. So I would say I would more agree with moving directly to IVF in this patient. And why? ChatGPT is saying because it gives multiple eggs in one cycle, it allows for genetic testing or PGTA, which is not testing for disease, by the way, but testing for viability. Improves chance of healthy embryo transfer, reduces miscarriage risk, and allows banking before further age-related decline. That's all true. Then it goes on to say because of the success rates. At age 40, the IVF success rate per embryo transfer is about 15 to 25%, whereas natural conception is 3 to 5% chances, and IVF is more efficient. So that's true. I do agree with that. The success rate is much higher with IVF. So in this case, that's what I would recommend as well, but not spending a lot of months doing IUI. So if you like this content, please subscribe. Please feel free to ask any questions or comments. I love to answer questions. Thanks for joining. Please subscribe.